Well, we're joined now by Patricia Marquis, who's England Director for the Royal College of Nursing. Good morning. Thank you very much for being with us this morning and spending a bit of time with us. Give us an idea of your concern this morning about this new wave of COVID cases.
So as your people have just said, the pressures are already there on the system, both in London but also across the whole of the UK. So the concern is as Omicron grows in its potency and more people become infected, more people will need hospital services and health services more generally. And that will just increase the pressure to beyond the point at which the NHS can cope.
And how are your staff doing at the moment? How are nursing staff coping?
So I think it's a really difficult question to answer, but across the system, the pressures have been there now for a long time. Before the pandemic, there weren't enough staff to deliver what was needed. And as the pandemic has gone on, people have become more and more physically exhausted, but also mentally exhausted by, what's happened over the last 18 months, 2 years. So staff are looking forward now thinking, oh my goodness, what is coming? In many places, they are already under immense pressure. And so they are starting to go off sick themselves, both with COVID, but also with physical and mental exhaustion. So it is looking like a very bleak picture for them over the next few weeks.
What sort of things do you think could help at the moment? What can be done to relieve some of that pressure?
Well, the government has to listen to whatever the scientific advisors are seeing in both the pattern of spread of Omicron, the effect that it's having on people and their health and what that means for the health services. But they also need to think about what the NHS is trying to deliver at the moment with the vaccination programme adding to the pressure, continuing to deliver all of the services that it wants to be able to deliver to people. So the science needs to guide what comes next to protect the NHS from what could be a real collapse if we're not very careful.
Do you think that non-urgent NHS care should be cancelled at the moment?
I think the science needs to guide whatever those decisions are. So the science needs to look at Omicron, and it also needs to look at what's happening in the NHS with NHS leaders so that they can base on the data that they can see the decisions they made. But they will need to consider what they do with non-urgent care. If they don't do that, those decisions about who does and who doesn't get treatment will need to be made by people at the front line, and that's not acceptable.
You talked about that shortage of staff potentially and the impact on staff. There are figures around today suggesting that 1 in 3 of the workforce in London will be absent by New Year's Eve. Is that in line with what you're hearing and your concerns?
Well, all I can go on is the data that I can see is being shared in the public at the moment. But if that is the case, that is a really significant impact on the ability of the services to deliver across London. But we can't just focus on London because we know from other waves what happens is it starts in one place and it very quickly rolls across all of the services everywhere across the UK. And so I think to focus on London now is the only reason to do that is for us to learn very quickly what we need to do to prevent a breakdown everywhere.
How concerned are you about the mental health of some of those you've been speaking to?
Very, very concerned. It is heartbreaking to hear my colleagues, describing what they've had over the last roller coaster, really, of the last 18 months, 2 years. And many people who I would describe as very strong, who've been able to, to cope with an awful lot, are at breaking point because it really is physically exhausting, but mentally an absolute up and down, and with looking forward, thinking what is going to come next. So I think for many, it really is very, very difficult.
Patricia, thank you for talking to us today. That's Patricia Marquis, who's the England Director